Welcome back to On the Story. I'm Bill Nigut. What we just learned is that providing quality medical services in rural Georgia is becoming an increasingly big problem. But for the next few minutes, we're going to take a look at one unique solution made possible by advanced technology. Joining me is Paula Guy, CEO of the Georgia Partnership for TeleHealth based in Waycross. And Bobby joins us from a faraway remote location.
Yes, I've traveled all the way across the studio, but I could be just about anywhere. That's the point. I'm here with Matt Jansen, Executive Director of the Atlanta office of TeleHealth. Matt's going to do an exam on me, but first, Bill, why don't you talk with Paula and set this whole scenario up for us?
Well, Paula, let's talk about what we're going to see here. We've got way over there on the other side of the studio. Matt is going to examine Bobby using tools that will send images where?
To a specialist or even a primary care doctor.
Through the internet,
Through
a secure connection.
Yes, it's very high quality. The peripherals that we use to look in the ear, eyes, nose, and throat, the stethoscope, to use to hear the lung and heart sounds are really better than they are if you're listening to them in a doctor's office.
So if I live in an area where a hospital cannot afford to have a neurologist, a cardiologist, I can go to the hospital, and if it's equipped with this technology, I have access to those specialists, even though they might be 400 miles away?
Absolutely, because it is very common in rural areas to not have neurologists, for example. If you have a stroke in a rural area, then you're really up the creek without a paddle. So if you have a neurologist, you can connect this way, see the images, do the scales, the examination, and it's as good or better than in person.
Okay.
You can change lives, save lives.
Bobby, what are we going to have you check out on you?
It gives new meaning to doc in a box. All right, Matt, you're going to do a brief exam, and I could be somebody who has walked into a hospital or a community health center or even a school that's equipped with this, and I have an earache.
Correct. So what we do is we use this all-in-one exam scope. I'm going to gently put this into your ear.
Hope my ear is clean.
Everything is looking good. And what we're going to do is we're going to capture that image.
Okay.
Right there.
So, Paula, we're now seeing this image. We see it on the TV screen, of course, but you could see it a doctor could see it on an iPad.
Oh, yes. To make it easy for a doc to pull it out of his pocket and to be able to see that same image right there on the spot and diagnose her very quickly. By the way, she has a very healthy ear and a beautiful, clean, light reflex. Bobby, it looks great.
The bill is in the mail, Bobby. How many locations? Really? Bobby, I think we're going to check out another, make sure you're okay in other ways, too, right?
Yeah, and we should make the point that you can't do this with your computer at home, obviously. You have to have the right technology.
Correct. So we use a couple different components and a couple different configurations, so this can work in a clinical environment. So that's what you really have to focus on, making sure that this works, and it's also safe and secure.
So now I have an eye issue.
You do?
Yes.
You have an eye infection,
yeah.
So we're going to grab a quick look. So I'm going to stabilize the camera on your eye, and we're going to focus it just a little.
So while he's doing that, Paula, how many locations across the state
We're
are
over
using
600 locations with over 200 physicians available, anything with an ology behind it. And by the way, Georgia's leading the nation. There's not another program that compares to this. We've become internationally recognized.
So you're in hospitals,
clinics, jails, schools, nursing homes. You can imagine an elderly patient being transferred to an emergency room unnecessarily when they could see the doc this way. The doc made diagnosis and the patient's kept there, and the trauma of putting them in an ambulance is done away with.
So this may not solve the problem of rural hospitals closing down, but it does make sophisticated diagnosticians available to parts of the state where they don't tend to locate.
Absolutely right. If a hospital closes down, to me, it is essential that we look at putting little clinics in these towns where the hospitals were, so they at least can get stabilized, or even, have a place they can go to be checked out before they have to drive 2 hours somewhere to see a physician or to another hospital.
Bobby, are you feeling comfortable that you've now been checked out as being in good shape?
Yes, I'm feeling very comfortable and assured that I'm in good health. But I was curious to know, Matt, where the future of all of this is going, because I noticed the other day you had a Google Glass device in here?
Yeah, so the consumer market is changing. You know, home health devices, a lot of mobile health devices are coming into the market. However, we still have to kind of graduate to that level of care within the home. But it's moving so rapidly. Healthcare can barely keep up with technology today. However, we're testing the latest and greatest devices out there, and then we're integrating them into our network. So this way, as we build kind of a capacity to do this in the home, and it's more available. And of course, when we have policy and we have an ability to actually receive payment for this type of service in our network, then we'll be ready for it.
Man, it's like the new house call.
Paul, we should very quickly point out, you are a nonprofit organization.
That's correct.
And so you get grants from government agencies, and you also have fees now from the locations that make use of your service.
Yes, that's right. I think we're the only program in the nation that's self-sustaining just on monthly and partnership fees from our partners who are participating. But I did want to make sure it's clear that there is legislation here that docs get paid the exact same thing as if they saw the patient in their office.
As they do it from a remote location.
That's correct.
Bobby?
All right, well, I guess the last question some of you might be asking is, where can I get this? Where is it available? You can check the website at www.georgia-telehealth-org or call 866-754-4325.
I'm Bill Nigut for Bobby Batista. Good night and have a good weekend.
This is a GPB original production.